Hi everyone, my name is Kinross Mitchell. I am an advanced paramedic, and in South Africa I'm an emergency care practitioner. I am your host for the Critical Care MSc podcast. Today is our first episode with my guest, JP Potgieter, who's a basic life support medic in South Africa. We are hosting from the beautiful Drakensberg. As you can see, the lovely mountains in the background. We are both on holiday, but we decided that we were going to bring it with us so that we can enjoy the scenery whilst we're chatting. So the topics today are going to be advancing in EMS. And this is an interesting topic because there's been a lot of chatter in South Africa about the removal of the short courses, which we'll touch on in a little bit, and how those that are currently qualified under short course qualifications can progress in their careers. Because if they can no longer progress the short course route, there are many concerns about how they will be able to reach higher skill levels or even higher up in the field itself. Right, so I am in the field now for 15 years. I am a BTech by qualification, and I'm busy in my third year of my MSc in critical care at the University of Edinburgh. And JP, tell us a little bit about yourself.
Right, thanks, Kinross. Thanks for having me on today. So I'm a legal advisor by trade. I obtained my law degree about 12 years ago, whereafter I got my BLS qualification.
Mm-hmm.
So in the week, busy doing law things, and over a weekend, I'd pick up some shifts.
All right. So tell me, what is your feeling about working at the level of a basic life support practitioner, knowing that there is intermediate life support, advanced life support at a level or qualification of critical care assistant, all in the short courses? So you were part of the short course curriculum?
Yes.
And now shifting over largely to a university type curriculum?
Yes.
Understanding this, where are you at? What are your feelings about being a short course basic life support medic and working outside of the field?
Well, let me put it this way. Competitively, the BLS short course was not or hasn't put me in a very competitive place in regards to salary. So I am actually quite limited because if I want to improve my qualification, I actually need to go get the university degree or diploma in order to increase it, which makes it a bit of a problem because as you can think, you need time in order to do that. It's not a 2 months or 3 months thing to do it. That is a year or 2 or 4 in order to get it. So that on its own puts me a little step back. Further to that is there's a lot of treatments that's out of my scope, for instance, that one can't. And one feels a little bit helpless sometimes when you get to a scene and first you have to phone and wait because you are not capable or you aren't, how can I say, taught how to treat certain
conditions and diagnoses.
Yes, exactly. Thank you.
Yeah, interesting. So you would say that your scope of practice is a little bit limited, and it might be difficult to intervene in some situations which require a higher scope of practice.
Yes, like an ILS or ALS to come in.
Yeah. All right. So looking at the fact that you are not even in the field, how do you feel about progressing as a clinical practitioner or even a non-clinical person inside the medical field when you're working in a totally different field? Because as you said, you're in legal, so you're you're different. You're doing something different at the moment from EMS. And if you did want to join the EMS field and leave your legal field, your legal advisory field, then I'm assuming you've got a couple of challenges which we might be facing. Tell me a little bit about these challenges of working full-time and studying full-time for this course specifically, in medical.
Yeah. Well, let's put it this. The first challenge obviously will be time. So where does one get time? Employers won't just let you go for a year or 2 or 4 in order to get a different qualification, which won't even benefit them. So where do you get the time? Secondly, one looks at the finances.
Mm.
In a sense of you have now gotten a certain lifestyle based on the salary or the position that you're in. And now you have to give up that lifestyle in order to go and follow this route. Well, not just the lifestyle itself, but you have to save up for studies. Because when you are, let's say, a 35-year-old trying to go in to the medical field again, who's going to give you a bursary? Or where are you going to get one of those?
So this is an interesting point. I would say that it might be a little tough if your employer is out of the medical field to ask them for assistance. However, coming back to some of the options that we can think about or consider for our our ability to get ourselves studying again, after some reflection, and I'd like to hear your input on this, but I've got some thoughts. So if you're in the field, I've been made aware, and I studied with paramedics from the short course route who made agreements with their employer who needed them to remain in the service for a certain period of time. And during that period, they had to complete a certain number of clinical hours. However, they were also allowed to attend class full time. So the agreement with the employer, it gave them the ability to study whilst keeping their work. Now, I'm assuming that this is difficult to find an employer that's willing to do this, especially if they're short-staffed. But if the employer requires a higher level of care, such as they need emergency care practitioners in the field, you might find that this employer is open to letting you proceed with your studies.
Yeah, no, 100%. It all depends on the company structure, in my opinion. So as you mentioned, that if the client or the company sees that they're going to require emergency care practitioners at a stage, but they don't need it right now, then they'll be more likely to give that to you. But the point remains, the difficulty that I've got, for instance, is not being in the field. So my employer won't see any benefit for them. If you, however, work in the medical field for a company, yes, it is possible to have those agreements.
Okay, so I got a little bit confused with the one part that you were discussing about whether the employer needs it or not. I would say that if the employer needs emergency care practitioners, they might be willing to send people or staff for training, knowing that they will get emergency care practitioners back to the service, and then this emergency care practitioner or paramedic or emergency care assistant is now locked in contractually with the company. So the company is almost securing their staff. And then if the staff are still, required to work additional hours, they're kind of scoring.
Yes, 100%.
Yeah. The other option that I can think of is a bursary. So I was very fortunate to get a bursary for my final year of studies when I was doing my national diploma. I was still 22, I think, then. 22 or 23. And by receiving the bursary, it was going to help me land employment when I graduate. And I will also have the opportunity to have that financial assistance from a company who is, how would I say, a company who has in their financial plan an opportunity to allow students to study. So go out, have a look for bursaries. This is another opportunity. There's I would say there's a bursary office at all the universities, all the major universities, where you can go and inquire about what bursaries are available. I would also suggest having a look at companies within the medical field to have a look if any of them are offering bursaries, knowing that you'll likely secure employment with that company afterwards for them to make their money back and for you to secure employment. What is your knowledge on bursaries? I don't know if I may have missed something.
Look, the only issue that I foresee with the bursaries is the fact that with a lot of companies that actually give these bursaries, people at the time that you graduate, they don't have positions for you anymore.
Ooh, that's an interesting one. I didn't think about that. So you've lined up that you will have a job with that company, and then suddenly the positions are already filled.
Exactly.
Interesting. I think the biggest challenge from that will be if the company is asking for the money back.
Yeah.
Yeah.
Now, luckily, usually in those type of agreements, there should be a waiver in that case because it's not your fault that they don't have the position. But one never knows. One never knows what type of agreement. The only advice that I can give on a thing like that is to just read the agreement. Don't just sign because you're happy that somebody's willing to give you a bursary in order to go study.
So bursaries are good, but I think the one limitation with them is that they're usually covering, most of the time they're just covering the fees. They're not covering the children at home or the spouse, living expenses, food, etc. You understand what I'm saying?
Yes.
So having a bursary is helpful, but it seems like you might have to rely on a spouse or a family member to help you to keep the expenses under control at home.
Exactly.
Yeah.
Exactly.
But look, thinking a little ahead, if you cannot progress to a university course, you yourself are a BAA, Basic Ambulance Assistant, or Basic Life Support Practitioner. You're in this legal field. You are going to struggle even with a bursary to take care of your daily expenses. So, although it's going to be difficult to progress clinically unless you find some support from family or friends, might have to look at other options about how to enter the healthcare field. And this is where things get interesting, but they also need to be creative. I'm sure you can agree with me on that one.
Yes, no, 100%.
So clinical advancement is one option, but as we've discussed already, it requires practical sessions and attendance. However, if we're looking at administrative advancement, this is maybe something where you can start studying
part-time.
Yeah, part-time, all right? Studying on your off days, after hours, studying from home. There are, I think most of the large universities are offering courses that you can study from home, off-site. And I would imagine that maybe what could we say? We could say a undergraduate course in maybe public health or courses in health and safety. Some of these courses may not require as much practical time as a clinical qualification would require. So this is an option. If you cannot get clinically or you cannot get clinical advancement inside a field, perhaps we have to consider looking at administrative advancements or slight deviation off of that clinical route into something like maybe a health and safety option, or supply chain management, or middle management, where you are now able to do a more administrative approach. So studying something maybe like a BSc in management, or what the qualification for a management?
Well, you get just your normal management qualification, basically at the business school.
Yeah.
So that you can do, it's basically a 3-year degree that you can do with that qualification. But a lot of that is also, one looks with a legal degree itself. I've in any case got one step ahead in order to enter the job market on the administrative level. I can call it that. But I think a lot of the time it's practical experience that one requires, and leadership skills.
You're coming from the legal field, and I know for sure that certain legal qualifications can be done off-site. You don't have
remotely, yes.
Yeah, remotely. So you can study remotely when it comes to law or getting an LLB.
Yes.
Now, what's nice is I'm assuming, and this is where you're going to have to correct me, I'm assuming that with a qualification as a basic ambulance assistant and a law qualification, you could go into medico-legal practice. Am I correct?
Yes, that is correct.
All right. Tell me a little bit more about how that would work. Do you have any knowledge on it?
Well, basically, my knowledge with that is limited, but in practice, as an attorney, you do have a medical practice that you can start. Basically, that is where the public or patients or doctors can come to you in order to defend their cases or to present their cases in the medical field like that.
All right.
So, but that is not completely in the medical field as such.
I think then at least your basic ambulance assistant qualification will give you some background into medicine when you are taking on these cases.
Yes, 100%. And the procedures that needs to be followed.
Exactly, exactly. All right. So just to summarize our very brief discussion, there are means of advancing clinically and administratively, even if you do feel very limited, as now that the university courses are the primary way of studying further. It will take a proactive approach from our side and from the listener's side if they are going to commit to push harder, longer hours, and cut back a little bit on expenses wherever they can, to be able to progress into those alternative options. So I think appropriate time management and dedication to seeing a final result is probably going to help you see the most progress.
Yeah, no, 100%.
Yeah. Any closing comments from your side?
No, got nothing from my side. It's just always interesting to see where life takes us.
Yeah, fantastic. And from my side, thank you to the listeners for listening. And we are going to enjoy the rest of our evening here in the Drakensberg, and wishing you all the best.